Hello and welcome to Expedition AEP Medicare Supplements. My name is Sarah Christy and I'm the Director of the Ancillary and Medicare Supplement Division for Agent Pipeline. Let's talk Medicare Supplements. AEP is right around the corner, so you may be asking yourself, why are we talking about Medicare Supplements? Well, simply put, not all of your clients will be candidates for a Medicare Advantage plan. You will need to have solutions in place for those folks. Also, let's talk sheer numbers. There are 10,000 seniors turning 65 every single day. That is a ton of prospects. Seniors need help navigating their healthcare choices, especially after coming off of group coverage. There are so many complexities to Medicare. They need someone who can explain it to them and help them make educated choices. Now, Medicare supplements are standardized, meaning every company must provide the exact same benefits for each plan. By that, I mean Plan F with carrier ABC provides the same benefits of Plan F with carrier XYZ. So let's get basic. Once a senior ages into Medicare, they typically have two options for their health care. Original Medicare paired with a Medicare Supplement and standalone Part D plan, or a Medicare Advantage plan. Now, while both of these options have their merit, we're going to focus on the Medicare Supplement option for the purposes of this discussion. Medicare Supplements, or MedSupps for short, are not part of Original Medicare. They simply add to or supplement Original Medicare. They are not overseen by the Centers for Medicaid and Medicare Services, or CMS for short. Generally, carriers offer a variety of plans to clients. More on that on the next slide. So I mentioned earlier that these plans are standardized. So why sell one carrier over another if all benefits are the same? Well, there are some differences. One thing that differentiates one plan from the other is the cost to the client. While all the benefits are the same, different carriers charge different premiums. Another factor is underwriting. One carrier may allow more serious health conditions than another carrier who may be stricter. Some examples of this include a carrier perhaps declining a client for being a diabetic, while another may approve the diabetic if certain other conditions are met, such as having diabetes controlled by diet as opposed to insulin. Extra benefits. Some carriers offer extra benefits to the member at no cost to them, and those could include things like a gym membership or dental, vision, and or hearing discounts. And from an agent's perspective, different carriers offer different amounts of commissions, as well as different types of incentives to the agents per app. How many plans are there? Well, there are quite a few, and we're going to see how many on the next slide. However, typically the most sold plans are Plan F, Plan G, and Plan N. Now, one thing to note about Plan F, it isn't available to be sold to people new to Medicare as of January 2020. If you were eligible for Medicare prior to January 2020 or are currently on a Plan F, you can keep it or pick it up. On our next slide is the chart that shows each plan and what they cover. As you can see, there are a number of plans to offer. Now, there are two other options which aren't on this chart, and they include the high deductible Plan F and high deductible Plan G. All right, so the Medicare Supplement plan options. Regarding the two most sold plans, Plan F and Plan G, there's not much of a difference in the coverage offered, but the pricing is different. Plan G is a less expensive option. Plan G requires the client to pay the Part B deductible, while Plan F does not. But wait, you may remember I mentioned another plan, Plan N. So let's zero in on Plan N. Why sell it at all? Why would a client want it? Well, simply stated, Plan N is more affordable than both Plans G and F. And why is that, you may ask? Well, Plan N features more cost sharing for the client. So there is a copay when the policyholder sees a doctor. After the Part B deductible is met for the Medicare calendar year, there is a copay. There is also a copay for ER services unless the policyholder is admitted. Also, Plan N is less expensive because the Part B excess charges are not covered on Plan N. But isn't that a bad thing, though? Well, not necessarily. There are almost no Part B excess charges if the provider accepts Medicare assignment. I would encourage you all to advise your clients to verify this when they select a physician. And 96% of providers who provide Medicare covered services accept Medicare assignment. And finally, 99% of all Medicare covered services are paid on assignment. All right, let's get into the household discount. You will see this most often as the acronym HHD. The household discount, very generally, is a percentage off of a Medicare supplement premium. Generally, the discount is for two spouses that both have a Medicare supplement with the same carrier. Now, that doesn't mean that they have to have the same plan. One could have a Plan G and the other Plan N, but they must have it with the same carrier. There are different requirements to qualify for the discount, though, and that varies by state and carrier. And we're going to look at that on the next couple of slides. Well, you may be wondering, why do carriers even offer a discount for living with somebody? Well, the theory is that a person who lives alone will likely have more insurance claims than someone who lives with another person. So the carrier is rewarding people who live with another person because it will likely save them money in the long run. But regardless of the reasoning, it does create a savings for the client. So let's talk about the different requirements. First, we're going to talk about the traditional model. In the traditional model, both Medicare-eligible adults in the household must have a Medicare supplement with the same carrier. The other Medicare-eligible person must be your spouse, someone you are in a civil union partnership with, or a permanent resident in the household. The discount will only be applicable if a policy for each person is issued and remains in force. The other model is the roommate rule, and it's the most liberal version of the household discount. So the roommate rule is for someone, whether it is your spouse or a partner, living in the residence over the age of 18. Some carriers have a little bit of a higher age requirement. Some could be age of 50. The other person is not required to purchase a policy. They simply have to live in the same residence to qualify for the discount. What kind of discount are we talking about? Well, this varies. It varies by state and carrier. The most common discount we've seen is 7%. However, it does vary by carrier, and it can be as much as 20%. And it also varies by state. So while a carrier, say carrier ABC, that offers 7% household discount in West Virginia, may offer no discount in Florida. All right, now that we've broken down the basics of what a Medicare supplement is, let's talk about our target Medicare supplement client. Now, as we've mentioned before, Medicare supplements are standardized. A member can simply pay their premium and any deductible they may have, such as if they have a Plan G, and then that's all they need to worry about. No network restrictions. So we all know how loyal seniors are to their physicians. They have likely been going to them for a long time and they feel very comfortable with them. Without network restrictions, they can continue seeing the doctor they are comfortable with. Now, a client who may need to see a doctor more frequently would likely do better with a Medicare supplement, as they would likely be paying more out of pocket in copays if they chose a Medicare Advantage plan. And again, with no network, seniors who travel to see family or have homes they go to in the colder months would benefit from a Medicare supplement. How can you sell a Medicare supplement? Well, as mentioned previously, Medicare in general can be confusing for your seniors. You will want to narrow down your recommendations to two plans: Medicare Supplement with a Part D plan or Medicare Advantage. If your client's best fit is a Medicare Supplement, you got to keep it simple. Research, quote, and recommend two plans and review each. How to best compare plans. With many carriers offering Medicare supplements, how can you recommend the best plan? Most carriers have a quote and enroll portal. However, it would be cumbersome to toggle between carrier portals to compare pricing. All carriers provide an OOC, or outline of coverage, and that includes the rates. However, calculating the rates to include household discount or any payment option discounts can be tedious. So your best bet is Medicare Center. Medicare Center is a quote and enrollment tool that includes access to CSG. CSG can automatically quote different plans across carriers and display them in a comparison mode. Super easy. In addition, MedSupp carriers are now allowing you to enroll directly from the CSG platform. You can also quote and enroll Medicare Advantage as well as ancillary too. And Medicare Center will soon feature a call recording and storage solution right in time for AEP with zero cost to you, the agent. Let's take a look at some good lead sources. Your current client base is a great resource. If you sell multiple products, and most of you do, it makes sense to reach out to, say, all your clients on a dental plan that are Medicare eligible and talk to them about their health care. Another option is T65 list. T65 lists can be purchased and generally include contact information for seniors who are turning 65, get it, T65, turning 65, that you can use to prospect. You can send letters or you can call them. Remember to follow all TCPA rules when using this resource. If you're not sure about TCPA, we can help you with that. Email marketing. Have you ever heard of the 9-word email hack? It's very simple. It is basically a variation of the following statement. Are you still interested in improving your, and then whatever your product or service is? For our purposes, maybe something like the following. Are you still interested in getting help with Medicare? I think we all know that the longer the email is, the less attention it gets. Most people scan. I know when I'm reading my own personal email, I tend to scan. Websites. I think it's safe to say most people use the internet to research things before they buy. Having a website is a good way to attract prospects. Not sure about setting up your own website? We can help you with that too. And then, of course, the ever popular and present social media. Seniors are on social media. Now, my parents, who will be 74 and 78 years old this year, are on Facebook and Twitter. And before you say to yourself, well, you should probably help them, taught them how to use it and all that. Nope. I'm not super tech savvy. I'm not even on Twitter. But a lot of seniors are. We have many resources devoted to social media advertising on our website, and our marketing team can assist on that as well. All right, let's talk commissions. Medicare Supplement plans offer commissions typically as a percentage of the annual premium. Most carriers offer advanced commission options where you get the full year or more, depending on the carrier, upfront, with renewals coming in as earned in the following years if the client stays on the plan. If the client continues to pay their premium, the Medicare Supplement plan is guaranteed renewable and is automatically renewed each year. Unlike Medicare Advantage and Part D commissions, CMS does not specify a maximum broker commission for Medicare Supplements. All right, it's a busy time in the Medicare Supplement world. This was a record year for new carriers, new charters, and new products. Now, we don't have time to review all carrier updates. That would take us probably until the next AEP. So we're going to focus on a few of the most recent. You can call your marketer or visit our website for a full list of our amazing carrier partners. First up, we're going to take a look at National General, an AllState company. This carrier introduced some innovative discount options for your clients this year. The discounts that are available, and this varies by state, of course, includes a roommate household discount. Remember, that's the most liberal type of household discount of 7%. Or if you have a dual applicant discount, so if both people in the household apply for the policy, that increases to 10%. Then there's an annual pay discount for 10% and an activity tracker discount at 5%. That is a potential stacked savings of 25%. In addition, there is a new rating class called Preferred Select available in many states. Now, as you can see in blue, these are the original states that AllState launched in. In green are the states where the discounts are available. Orange states show where they are coming soon. So in August 1st, Arkansas and North Carolina rolled out. But coming up next for October 1st are Colorado, Illinois, New Jersey, Texas, PA, Wisconsin, and Virginia. In addition to these discounts, in the states noted, they have introduced new refreshed rates. And coming in October, a new charter. So for the new charter, effective 10/1, states Arizona, Colorado, Illinois, South Carolina, and Texas. And in gray, we have pending approval. So we don't have a date yet for these for the new charter, New Jersey, and Virginia. Lots of good stuff happening here. AllState is also offering an excited agent incentive. So this is called their MedSupp Blooming Spring Bonus, and it is earn $200 per underwritten Medicare Supplement, earn $100 per birthday anniversary Medicare Supplement, and earn $50 when you add DVH to Medicare Supplement plans. I didn't cover this, but AllState does have DVH solutions as well. And so the bonus cash for MedSupp applications kicks in once you hit 3 sales, and it applies to every MedSupp sale made that month. The DVH bonus cash applies to all DVH bonus applications from the very first app. Now, this incentive is going on through September 30th of this year, and we do anticipate a fourth quarter incentive coming soon. All right, moving on, we're going to take a look at one of the biggest Medicare supplement launches of the year, Aflac Medicare Supplement. I don't think we need to spend too much time talking about what a well-known brand Aflac is, but I thought it made sense to review this slide. You can see that they have $22.1 billion in revenue, the #1 provider of supplemental health insurance at the worksite in the U.S., over 12,000 employees. Aflac is massive. And now we're going to look at some of the product highlights. So Aflac is featuring plans A, F, G, high deductible G, and N. This product is priced to sell. They're offering a 10% household discount, and this is administered by Aetna, and they utilize Aetna's world-class online enrollment tool. Over 95% of MedSupp enrollments being done through this tool on organic Aetna paper. The contracting and licensing is also handled by the Aetna team. Initially, they had 9 approved states for an 8/1 launch, but they filed in over 30 states with approval dates coming. And this is fresh off of the presses, as of today, there are a total of 17 states open for sales, and these include Alabama, Arkansas, Arizona, Delaware, Georgia, Iowa, Illinois, Michigan, Nevada, Ohio, Oklahoma, South Carolina, South Dakota, Tennessee, Texas, West Virginia, and Wyoming. However, you can see on the map there are many more that are approved coming up very soon, so definitely watch out for that. Aflac is also hosting an agent incentive, and the way this one works is that you earn $500. $500, you can see that correctly, when you write 3 Medicare Supplement applications. And then you earn $100 for every app after the initial 3. There are no limits to what you can earn. And this incentive is running through September 30th of 2022. If there's a fourth quarter incentive, we will notify you of that as well. All right, next up is ACE Medicare Supplement, which is a Chubb company. Chubb is the world's largest publicly traded P&C insurance company and the leading commercial lines insurer in the United States. So while Chubb is a new entrant into the individual Medicare supplement space, they've been insuring folks for a long time. And you can see here some of the key highlights of Chubb. They have more than $200 billion in assets and reported $46.8 billion of gross premiums written in 2021. 93% of Fortune 1000 companies have at least one Chubb product. They have over 31,000 employees serving 54 countries and territories. Very impressive. All right, and some product highlights here. Lowest base rates across the board. I have seen these rates in states, and they are awesome. They are rated A++ superior by AM Best. And I have to say this here, I have never in my 15 years of working in this industry seen an A++ rated carrier. So this is one for the books. They're offering plans A, F, G, high deductible G, and N, offering a 7% household discount, just one policy. They have a new enrollment tool. They have 23 states approved for a September 12th selling date, and they're filed in 28 states with approval dates coming. Now I'm going to pop up a map here in the next slide or two that shows what those states are. Some additional details. I mentioned the 7% household discount. This is a roommate discount, so currently living with a spouse or have a household resident age 50 or older. Now, there are a couple of states here that have additional requirements. Those are North Dakota, Oklahoma, and PA. You can talk to your marketer about what those entail. And then we've got some underwriting highlights for you. For heart, they have a 2-year look back. Cancer, 2-year look back. Stroke, 2-year look back. Diabetes, up to 50 units of insulin daily. And then combination meds for diabetes or high blood pressure count as 2 independent medications. I mentioned the map here, so you can see that sales are live in the states in blue. The states in yellow launch for sales on September 12th, so coming up very soon. Kansas, Illinois, Indiana, Ohio, Georgia, and PA. Now, ACE is also offering an incentive, an agent incentive, and it's awesome. So first case submitted when the contract, when you've submitted your contract in the first 30 days. So just so that you know, contracting began on August 8th. So you have time for this huge incentive, which is $300 on the first underwritten case. Then issue 5 more before the end of the year and get $250 per app for underwritten and $50 per open enrollment app. Lots of opportunity here. Next on our update list is Ellipse by Lumico Medigap Solutions. Lumico's new charter Ellipse launched in 2021. They are rated A, which is excellent, by AM Best. Some underwriting highlights that you can see here for heart: they have a 2-year look back on heart attack, bypass surgery or stent, AFib, angina, cardiomyopathy, heart valve disorder in the last 2 years will be considered. This is awesome. They have a 2-year look back on cancer, a 2-year look back on stroke, and if you have a client that is a diabetic, they can be on 2 diabetic meds and 2 blood pressure meds. One of the diabetic meds can be insulin, and 1 pill if the insulin is under 50 units. And now featuring, this is also hot off the press, 2 new states launching for Ellipse for sales on September 12th. So coming right up, California and Washington. Some highlights for these states include full commission on birthday rule business in California, as well as 11% street commission in Washington. Great stuff coming up. Now, Ellipse's agent incentive is tiered, so it's a little different. So in Tier 1, if you have 3 to 5 issued apps, you get $75 per open enrollment or $150 per underwritten. Tier 2 bumps up that pay rate a little bit. So once you hit 6 to 10 issued apps, which is $100 per open enrollment and $200 per underwritten, then Tier 3 is $125 per open enrollment and $225 per underwritten. And you can see here the state availability for Lumico. California and Washington are not yet highlighted on here because the sales are not live yet, but as I mentioned, they will be live on 9/12. So definitely watch for that. We will be sending communications out. And finally, Medicare Supplement. Some product details. They are rated A, excellent, by AM Best. Some underwriting highlights that you can see here. They have a 2-year look back on heart, a 2-year look back on cancer, 2-year look back on stroke, and if your client is diabetic, they will consider type 2 diabetes with up to 3 high blood pressure medications. That is unique in the market. And you can see the state map here where their new charter is available in the dark blue states. And then, of course, Medico is offering an incentive as well. This is an unlimited agent bonus program. So submit 3 qualifying applications and you'll earn up to $525 for those initial apps and unlimited bonuses thereafter. So earn $150 per underwritten MedSupp application or $175 when combined with Gold and Platinum Dental. Earn $75 per guaranteed issue MedSupp application or $100 when combined with the Gold, Platinum, and Dental. And earn $75 per open enrollment MedSupp application or $100 when combined with the Gold, Platinum, and Dental. So really excellent, a lot of opportunity to cross-sell with Medico's dental plans. Thank you for joining me today. AEP is right around the corner, and we look forward to going on this journey with you.